This video was made possible by the Laurel Foundation, Bay Area Lyme Foundation, and the Limelight Foundation.
Stephen Harris, and I'm a medical doctor. I went to undergrad at UCLA, went on to Howard University for medical school, and then completed a family practice residency, University of Illinois in Chicago. The real modern history of Lyme disease goes back and where the organism and the disease got its name from, Lyme, Connecticut, in the mid-70s, when a group of children developed juvenile rheumatoid arthritis in numbers that were far higher than the prevalence in America. So a young doctor, Alan Steer, went to Lyme, Connecticut, interviewed many of the patients and their parents, and found that there was indeed likely an infectious cause to this. He felt that it was a virus, and it wasn't until the early 80s when Willy Bergdorfer, who was working for Rocky Mountain Laboratories, part of the NIH in Montana, found that indeed a spirochete, a corkscrew-shaped bacteria, was responsible for Lyme disease. So first of all, Lyme disease is the most common vector-borne illness in America and the most common tick-borne illness in the world. And this is a worldwide pandemic. Most countries have had cases of Lyme disease, and every state in America has reported cases of Lyme disease. Initially, the Center for Disease Control felt that for years there's been about 30 to 35,000 cases a year in America. However, those were confirmed cases, and they felt that the actual number was much higher, perhaps 10 times higher. All of a sudden, a few years ago, the number went up from 33,000 or so up to over 300,000 cases, almost overnight. And the Center for Disease Control still states that that number is an underestimation of likely new cases a year in America. There was a lot of reasons, some were political, some were scientific, that really illustrated what had been going on and what many of the practitioners and patients and other advocate groups have known for many years, that there's much more than 30,000 cases a year. There's a few different perspectives on this, and like many things with Lyme disease, there's also controversy about this. Lyme disease is officially, by the Center for Disease Control, an infection caused by one bacteria, Borrelia burgdorferi, that's transmitted by ticks, black-legged ticks. There's only one or two species, one species in the West Coast and then a different species on the East Coast. Now, that's your classic and very restricted definition of Lyme disease. Actually, Lyme disease as a concept, especially among integrative physicians and among physicians who are in the naturopathic world, and especially among doctors who are Lyme literate, consider Lyme disease a more general term that consists of multiple systemic intracellular infections that live inside of our cells, an infectious disease syndrome of all of these. And that means that there's many different organisms that with Borrelia burgdorferi as one of them create a complex, almost a complex illness of which both these organisms and the immune system and other aspects of the body are all involved to create the disease process. Now, there is mounting evidence that there's other ways to get the Lyme organism itself. We know that the organism can be found in breast milk. We know that it can be transferred from mother to fetus. There's hard ticks, hard body ticks, or soft body ticks. There's big ticks, there's little ticks, there's adult ticks, there's nymphal ticks, which are basically adolescents and usually the least well-behaved. Some species of ticks carry the agents that cause Lyme. Other species of ticks cause other infectious agents. What we know is that ticks are sewers of infectious disease. They're amazing for carrying a ton of various diseases. Some are bacteria, some are viruses, some are parasites. And at times, when the tick feeds on you, some of those infections are going to be transmitted into you. Sometimes they're not. Sometimes 4 different infections will be unleashed by this tick into you all at once. What we know in Lyme disease, and why we don't just call Lyme disease for the most part, Borrelia burgdorferi, is that there's at least 3 so-called co-infections. Co-infections are infections that were someone to just get those infections and have a normal immune system, they may not actually get sick. If they have Lyme and they get one of these infections or more of these infections, not only do they get sick from the actual Lyme disease, but they also get sick from these various infections, and the whole is greater than the sum of the parts. Lyme disease is a clinical diagnosis, which means that if you get bit by a tick and you become sick afterwards in a way that's consistent with Lyme and you respond to treatment, you probably have Lyme, even if you, 1, don't do a test, or 2, test negative. The tests are improving as we go, as time goes on, but they're not perfect. One of the reasons why there's so much, in my opinion, underdiagnosis is that the Western blot isn't always done. What is done is what's called an ELISA, which is also an immune test, an antibody test, but it looks at the overall quantity of antibodies that one makes against the full organism. And what we know about this organism is it doesn't induce the human body to make a very big response all the time, especially later in disease. In early disease, 4 out of 10 times it might make the body create a nice response, but later on it's much less than that. What happened in reality, because Borrelia burgdorferi doesn't induce a huge response, is that many patients would have a negative ELISA test and never actually get the better Western blot. So many people over the decades have been left out because they had a negative ELISA. And this has been a huge problem. There's still quite a bit of debate about this in a lot of high academic circles about using the 2-tier test. So to make matters worse, not all Western blots are created equal either. If you think of the organism as like a small snake, and these little twigs are coming off the surface of this small snake, the immune system can't really recognize that whole snake. So what it looks at are those little twigs on the surface, and those, let's call those surface proteins. Some of those surface proteins are really useful. So other organisms in the bacterial kingdom also will use those proteins. So if you look at only a couple of the really important surface proteins or sticks, you may miss some other important ones. What we know about this disease and what Willy Burgdorfer and his other group have found over time is that those surface proteins actually change over the course of the disease. So initially, perhaps there's 3 different proteins that are important. After several months, 6 to 12 months in the body, there's going to be different surface proteins. So the Western blot will look totally different. There's dozens of tests we can do. Some look at the infection, some look at the immune response. None of them are perfect. They all have limitations. We would love that perfect test, but so far there is no perfect test. So there's vertical transmission of Lyme disease. We know this, that the mother can transmit Lyme to the developing fetus. There's very likely, and there have been cases of breast milk transmission of Lyme disease. There's been a few studies very early that suggest horizontal transmission, which is person-to-person transmission. It hasn't been proven, but the evidence is mounting. The likelihood of pure blood-borne transmission through the blood bank is very high, and we know that one can get one of the co-infections, Babesia, in the blood bank. The psychological toll that this disease takes on people, both from causing a direct nervous system disorder, but also all of the social ramifications that happen from this disease, happen from not being believed, happen from having a good day and then 5 bad days, and having your loved ones not understand that you look fine, but that on the inside you feel like you're dying in 14 different ways. That one day you can walk and the next day you can't. One day you can eat, the next day you can't. The next day you don't want to, the next day you want to eat double. The fluidity of this disease is so mind-boggling that people get their minds boggled from this thing. It's horrible. And oftentimes we talk to patients and we agree that although terrible, sometimes for relationships, cancer is an easier thing to have because at least you know what someone has and that there's an endpoint one way or another. With Lyme, that endpoint is often so nebulous and gray that the unknown, the not knowing, the feeling that you're better and then having symptoms come back at some point or a new symptom come up or having 30 symptoms all scream at one time on the same day and then in the afternoon you have an hour free and then it comes back screaming right back at you. It's nearly impossible for everybody to stay emotionally, fundamentally intact. The financial impact is terrible. It's ridiculous. It's completely unfair. And medicines aren't covered. Often tests aren't covered. Almost all of the alternative treatments aren't covered. And it's remarkably difficult. Even if a patient could get her or his antibiotics and pain medicines covered, for example, for the vast majority of patients who've been sick for a long time, that's not enough. That many of these other patients, these patients do need great diets, exercise programs, therapists of one sort or another. And it's a part of the devastation of Lyme disease. Over the next 5 to 10 years, the field of Lyme disease is probably going to change vastly. Much more funding is coming in for studies. There's a great deal of interest that is developing among people who have resources. There are so many studies that are dealing with Lyme disease, the organism, and people who have Lyme. It's very welcome. I think there'll be a lot of improvements in diagnostics. I think that there will be some very important but limited improvements in antibiotics and specific treatments for Lyme disease. Where we really need the improvements is in the understanding of chronic illness. As a society, we don't really think of chronic illness as an interplay of the body, the disease, inflammation, the immune system. We don't think of all of the variables that are involved in a process. We just think of isolating one variable. We think of one organism or one problem. Many of the sickest patients, there's no way this is just one problem. And currently we can't really study them because there's too many complex overlapping problems that are related to Lyme. And so as a society, what we need to do, and it seems that we're moving in that direction, is understanding chronic illness a bit more holistically, a bit less reductionistically. And because of that, because there are so many incredible providers, so many amazing doctors and naturopathic physicians and other forms of practitioners out there who are starting to work together like never before, as a team, the hopes and prospects are absolutely overwhelming and exciting. Because with a group of people who all are dedicated to treating Lyme disease through their own personal insight and their own knowledge base, using science and using other systems of health and healthcare and understanding of the world, working together in a group is the way that the sickest group of patients are going to recover their health. And it's really quite exciting.